Why on earth won't they do the right testing to help with mental health, with depression, and also with cognitive function? Why won't they do the right testing? This is Dr. Murray with Murray Natural Integrated Health here in Hastings, Nebraska, doing a short video here for you today, talking about the Mayo Clinic, an article that they have on their website talking about mental health, the link between nutrition and mental health. And the question I'm always asking is, why aren't they doing this testing on a regular basis? An article on Mayo Clinic, it's also on their store Mayo Clinic website, and they're talking about supplements and nutrition on this website. It says here the brain depends on a steady supply of nutrients to function optimally, and deficiencies in specific vitamins and minerals can contribute to mood disturbances, memory issues, and or feelings of fatigue. While supplements alone is not a cure for mental health conditions, it can support an overall treatment plan when combined with other treatment options such as therapy, medications, and lifestyle changes. Well, no duh, that perfectly makes sense to just say that, hey, if you're eating properly and if you have deficiencies, if you deal with those deficiencies and eat properly, it may actually help with a myriad of conditions in your body. That perfectly makes sense. But they go much, much further than that. Omega-3 fatty acids, the first thing on their list. And it says there the role of omega-3 fatty acids, particular EPA and DHA, they're essential fats, I'm quoting from their website here, found in fish oil that supports brain function and reduces inflammation. Studies suggest they may help manage symptoms of depression and anxiety. Wow. This is okay. The Mayo Clinic is mentioning this. Now, the funny thing is that nobody tests for this. The Mayo Clinic is saying this, that this is good for mental health, helping to manage symptoms of depression and anxiety and all kinds of other things. The DHA part in particular is good for cognitive function and serotonin, dopamine levels, lots of neat things. And we get primarily, we get the most of this from fish. You get some from flax, hemp, and walnuts, the other omega-3 ALA. But still, we know that the average American does not get enough omega-3s in the diet. The Centers for Disease Control says that around 80% of Americans do not get sufficient amounts of omega-3s in their diet. So here it is, simple, easy thing. And the Mayo Clinic is coming very boldly out and saying this. Their recommended dosage says 1 to 2,000 milligrams of combined EPA DHA daily. Now, since we know omega-3s are low in our diet, and most people will not get them in on a regular basis, and clinicians such as myself who actually do testing for this, we have found that a lot of people are deficient. I'm telling you what, if you've got brain fog, inflammation in the brain, Alzheimer's, depression, anxiety, you're starting to drop names, you can't remember names properly, tired, fatigue, any of those kinds of things, mental illness, why aren't you having your omega-3s tested? Because you may not be taking enough. That's the reality. You can go ahead and eat fish, please do, but you may not be getting enough omega-3s. I've had patients who are taking 1,000, 2,000 milligrams omega-3s, and guess what? You test them on a standard medical test, just ordered several of them today for patients, and you find out they're still low. Why would they still be low? Well, it might be because you're actually not absorbing it properly through your GI tract, because people that have bad tummies may not be absorbing their omega-3s properly. But it's not just from a cognitive function or from a depression, anxiety, and mental illness kind of standpoint. The EPA portion of that fat is also anti-inflammatory, so it's good for the entire body. So that particular omega-3 fatty acid, that is important for cognitive function, and even so much the Mayo Clinic specifically mentions that here. So when somebody came in here just yesterday and said, well, I don't know, I've got a family member who's having problems with depression, anxiety, and so we're doing all these different tests, going all these different places, and I said, well, have they checked their omega-3s? Oh, they don't like fish. What are you talking about? Listen, this is not about a want. They don't like it. They don't like it. Well, too bad. If you are deficient in something, it's going to affect you somehow. Fish or fish oil, you either get it in or you get it in, getting enough omega-3s, and maybe that's through flax, hemp, or walnut, lots of other potential options there. But however you need to get it in, you need to get it in. It is a grocery list item that you need to get in. It's essential. It's called essential fatty acid. I didn't make it up. The Mayo Clinic, they agree that people need it. So you should get it tested. Why aren't they testing these things? Why aren't they? You'll have to answer that yourself. Probably because it's not really much of a pharmaceutical. But at any rate. Okay, so B vitamins is the second one. They recognize here, this is from the Mayo Clinic, just reading from their website. And it says here, B vitamins, especially B6, B9, and B12, are critical for energy production and neurotransmitter regulation. Deficiencies can lead to mood disorders and cognitive impairment. And you get some of these from your leafy greens, get some from eggs, some meats, fortified cereals, and B-complex supplements. So there are people who have genetic weaknesses and they do not process their B vitamins properly. And there's lots of people that do truly have straight out deficiencies. We test for these all the time, and you can find deficiencies. The older you get, the more likely you're going to have some B deficiencies. But still, some people need more. Why? Because they have some genetic weaknesses, because they're having anxiety and depression, and they're having a lot of stress. Their brain is having to work overtime, and so they need some of those B vitamins that are used in the processing and the creation of neurotransmitters such as serotonin and dopamine and GABA and all these different neurotransmitters. And they need to change their diet, number one. But secondly, if they're not getting enough the green leafies in there and getting those good grains in their diets, etc., then perhaps they need to do some B supplementation. And guess what? You can test for it. You can test for it. Not to test is to guess, but to test is to know. And so if somebody is having anxiety, depression, mental illness concerns, they have cognitive dysfunction, memory issues, Alzheimer's, whatever, why aren't they having their B vitamins tested? You certainly can test that. And of course, the Mayo Clinic, they specifically mention here around, they said that you should be doing, that can be doing some kind of supplementation with B vitamins if you're not getting those in your diet, but you can test for them, of course. Next one, vitamin D. This is from the Mayo Clinic, specifically states here, vitamin D, known as the sunshine vitamin. Vitamin D influences mood regulating neurotransmitters such as serotonin. Is somebody taking an SSRI out there? Well, maybe your low vitamin D levels are exacerbating that problem, at least making it worse. Some people might need medications, not saying you don't, but some people have a true deficiency and they need to get to the root cause of those deficiencies. Low levels, according to Mayo Clinic, are linked to depression and seasonal affective disorder. And guess what? You can, of course, test for it. Have you ever heard somebody goes in to have depression or anxiety, or maybe they're having low cognitive function, and they had their vitamin D tested a long ways back, and they're taking vitamin D, but they haven't retested anything, or maybe they've never had their vitamin D levels tested. In 2009, we tested around 200 vitamin D levels, and 75% were low. There are a lot of people who are clinically low. It's an easy one to test. Not to test is to guess, but to test is to know. Vitamin D, even the Mayo Clinic acknowledging that. How about magnesium, zinc, another two that are on the Mayo Clinic's website. They acknowledge that these minerals can help regulate stress hormones and help with brain and immune system signaling. And they understand that that also can be related to depression, also cognitive dysfunction in general. Obviously, we want to make sure you're getting your whole grains from the magnesium standpoint, your whole grains, even seeds, zinc as well, some of your seeds, some of those things, spinach also with regards to magnesium. But you can also supplement with those things. You should be talking to your physicians about it, and you should be tested, because if you're low in zinc, you don't want to take too much. Some people can take too much zinc and have zinc toxicity. That's why when we are doing an actual functional analysis, blood analysis, we're looking at nutrients. We're actually testing. We're not guessing. It's important to get to the root cause and to actually understand, do you need to take something? Maybe you need to take less. Maybe you need to take more. You won't know unless you're testing. And this was another interesting one, the last one on their little list here, on the Mayo Clinic's website, says here, probiotics. Wow. The Mayo Clinic is coming out acknowledging that there is an emerging body of research that's highlighting the gut-brain connection, the dysbiosis connection between probiotics or the healthy bacteria in your gut and proper cognitive function. So people that have problems with their tummy, it may be affecting their brain more than they even know. So your probiotics shows that probiotics can influence mood and mental clarity, according to the Mayo Clinic. So some of your fermented foods, also your probiotic supplements, these things can of course support your stomach and some of that dysbiosis, but you can actually test for it. All these things you can test for. And if you've got a serious problem, why do you just want to keep on throwing something at it and you keep having the same result? Sometimes you need to get to the root cause of things and to test and not guess. And on the probiotic side, you can actually test. You can see what microflora is present, how many of the good guys are present, how many of the bad guys are present. That could be yeast or bacteria, other dysbiotic bacteria. What kind of inflammation is in the small bowel or the large bowel? It's incredibly important for people who are having symptoms and they're not going away, that you have things fully evaluated. And all of these things I just mentioned, every single one of them, they can be tested for. Not to test is to guess, to test is to know. And so that's what we try to do in our office here, is to try and find objective, science-based recommendations to help people so their body can live, so they can live in an optimal state of health. And especially when it comes to mental health, cognitive function, memory, everything I just mentioned here is all from the Mayo Clinic. So if you are interested in having a nutrition evaluation, a functional medicine evaluation, don't hesitate to give our office a call. And that's our area code 402-463-4257. Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.